Introduction to Data Literacy.
Elevating our ability to talk about data. Course overview. Getting started. Why are we here? Lesson 1. Diagnostic analysis. Lesson 2. Back to basics. Lesson 3. Signal and noise. Lesson 4. Pitfalls and warnings. Lesson 5. Best practices. We have heard of terms like big data and information age and storage. But what does it mean, and why is it important for me to understand this? We are living in a new age, like the Bronze Age transitioning to the Iron Age. We are currently transitioning to the information age. According to The Economist back in 2017, data surpassed oil as the most valuable resource in the world. It used to be hard to get your hands on data, but now data is everywhere. It's a data tsunami. Even our phones are collecting more data than we should even feel comfortable about. Every industry is impacted by this flood of data, especially healthcare. And the health systems that learn how to navigate and effectively use this overwhelming amount of data will be the health systems that survive. That is why we are here. We are attempting to provide the skills needed to navigate and effectively use data. Course objectives. The overall course objectives for this presentation is to increase our understanding of data's role at UVA Health, improve our ability to navigate this data to make data-driven decisions, help us practice evidence-based care and performance improvement, help us meet our targets and goals. Lesson 1. Diagnostic analysis. We'll start out by taking a dive into diagnostic analysis. We'll provide an example of how data can be understood to help make data-driven decisions. We'll define what diagnostic analysis is, and then dive into data's journey from its raw form to a data-driven solution. Have I mentioned data-driven? Types of analysis. Diagnostic analysis is a step above descriptive analysis. We'll circle back to descriptive analysis later in the presentation. Diagnostic analysis is using analytics alongside subject matter experts to determine the why of our data. Predictive analysis and prescriptive analysis are not covered in this presentation. In using diagnostic analysis, we are asking, why did this happen? We are looking for trends or anomalies. The elements we'll discuss related to diagnostic analysis are data, information, knowledge, and insight. A data journey. Overview. At the start of our data journey, we have the whole UVA health system environment and all the data packed in there as it is now. We want to take raw data from collection to data-driven decisions. At the start of every data journey is a data-driven question. When we are looking for a data-driven solution, we have to ask a question that can be answered with data. For today's example, we want to know, how can we reduce the occurrence of C. diff infections? To address this question, we have to collect our data. Data collection is the process of gathering data systematically and consistently. This image is an example of data being collected in EPIC.
Hey, Joyce, what are you doing? Why, I'm typing in patient data into Epic.
Once we've understood how our data is collected, we can access our data. Once data is collected, it is stored, analyzed, and processed without the original context. Context. The context is the set of circumstances or facts that surround a particular event or situation. For example, take the data points 1, 10, and high. Can you tell what these data points mean? No, you can't, because it's hard to know what this data means without understanding the other facts surrounding this event.
Joyce, do you smell burning popcorn?
Why, yes, Max. I put 1 bag of popcorn in the microwave for 10 minutes at high heat. 1, 10, high. I believe this created the burning popcorn smell to which you refer.
Whereas earlier we could not tell what 1, 10, and high meant, now we know that these are data points that resulted in burnt popcorn smell that has filled the office. Yuck.
This is data.
Data is raw. Data is unorganized. Data is unanalyzed. Data is facts without context. To turn data into information, we need to process and contextualize the data. This is information. Information can be presented graphically. Here, you can see that cefazolin is the antimicrobial most associated with hospital-obtained C. diff. Information is structured, organized, analyzed, understandable, relevant. Information is data with context. Information, data with context. Context, context. Information is data with context. The data journey. Knowledge. Next, we need to push our information into knowledge. To do this, we need to organize our information and provide additional meaning. We already know there is a link between cefazolin and hospital-obtained C. diff. This graph shows that cefazolin is also frequently used for perioperative pharmacoprophylaxis. By organizing these data together, we are able to provide meaning that the use of cefazolin for perioperative pharmacoprophylaxis may be leading to increased cases of hospital-obtained C. diff. Knowledge is meaningful. Knowledge is useful. Knowledge is intuitive. Knowledge is organized information.
The data journey. Insight.
Once we have the knowledge that cefazolin, for perioperative pharmacoprophylaxis, may be increasing cases of hospital-obtained C. diff, we need to work with subject matter experts to apply our knowledge and give us insight. This is Insight. Insight is working with the neurosurgery team to stop preventive perioperative antibiotics within 24 hours post-operatively in patients with spinal and/or external ventricular drains. This led to the result of fewer cases of C. diff without increase in surgical infections. Insight leads to data-driven decisions, supportive interventions, and improved outcomes. By transforming data through its full journey, from data to information to knowledge and insight, and communicating that data effectively, we can provide the appropriate context and subject matter expertise to yield data-driven decisions. So what is our data-driven solution? Through our complete data journey, we now know that in order to reduce the occurrence of C. diff, we must reduce unnecessary cefazolin prophylaxis in neurosurgical patients.
Yay! Ta-da!
Yay! Applause. Do you remember this slide from earlier in the program? We've taken you on a journey to understand diagnostic analysis. In our next chapter, we'll head back to the first step on our data staircase and learn about descriptive analysis to help answer the question,
What happened?
there's a lady I know, and she wants to be sure what has happened and why did it happen. When she gets there, she knows she needs an analyst and a subject matter expert. Ooh, ooh, and she's climbing that stairway to data heaven. Data heaven.
Oh, Joyce.
Yes, Max?
Joyce, how do you say data?
I say data.
I say data. Data, 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 data.
And she's buying a stairway to data heaven.